administrator, telling how skillfully Finns are doing administrational works and so on. However, in Finland, sport is really, really wrong, strong social phenomenon. And now I return you see this active city, and active city concept generated by TAFISA, which is sport organization. I think this social environment and this, you see this kind of it's this kind of contents have to be there in this active city concept. If you think about Liverpool, for example, it's a soccer, football, and so on. This kind of the youth start with that one, and then they go to pub or exercise, physical activity, or both. So for example, you see this kind of. I think this is really it's difficult, but it's a must to open. I guess. But it means that it's more psychologists, sociologists, and so on. This kind of sciences are there, beside medical science. Then I would like to hear about these possible partners. For us, I think this return to this situation. So WHO is.
Even though we have to distinguish between local partners, regional, right, and international partners.
Did you have any question mark there, but did you go deeper in this?
Well, to that level, what Wolfgang said, that we talked about potential at these levels, starting with global WHO and so on.
And it's important there's local partners and global partners. So, okay.
So, if you read the documents of WHO, you will see that the organization addresses to the health service, mainly public health organizations. According to that Wolfgang said, I think it would be quite well after all these decisions to inform the offices of World Health Organization that TAFISA became, in a way, a partner in this area, directly partner, not as mentioned as sport organizations. Because they are not aware that there is such an organization with many members in different countries that can implement the ideas. So yesterday I have talked about the barriers and this is such a barrier between World Health Organization and national sport for all organizations.
I have to agree and disagree with you. I disagree in that sense that if we look at the settings work in health promotion under WHO, we have the concept of healthy school, healthy workplaces, healthy cities even. It's not only the healthcare. We have health promoting hospitals, which is healthcare. But I agree with you in that sports or physical activity in those settings is in a minor role. And TAFISA has, in this sense...
I'm talking about this second part.
Yeah.
Not...
but you say that WHO is concentrating on health care. But
I didn't say that.
Okay, I misunderstood you.
Well, but when we come to this picture here, I think this is really good when we look at it through this frame of process and product. So it means that in the beginning, this is really process.
Oh, most definitely.
Really process, and then finally, when it's successful, so it's a product.
Yes.
And even so that, I don't know, my Finnish colleagues, listen carefully what I'm saying now, because I want to, for example, in Finland, it's really, you see, interesting situation that that when Finnish Sportball Association talks with the city of Helsinki and city of Heinola and those cities, for us it is really important that we are doing the process with them, and it's motivating process. But then when we have, you see, district organization, and they have, you see, network of municipalities in the local level, they are really consulting communities, and they are reporting us that now we go as a sport organization telling to the community this is good way to do. They are small organizations, and you see they need support and channel to discuss. However, it's a little bit same here in Tafisa. There is about 20 active cities in the world, and I'm pretty sure that this Tasmanian city and Liverpool, they have not been consulting each other, perhaps not. So when we find those active cities having a process and go forward, it really means that we generate this, create this concept by discussing, developing, and finally finding a product. In Finnish terms, it's a little bit same. And not very, very much the same. What my colleague is doing now, yesterday, and so that we find, you see, the process national level, and we go forward and are going to generate perhaps good product as well. However, at the same time, it's a network. I would like, because this is really starting point, and I interpret this picture that is pretty good. Well, are there any other? I think that I'm very happy about this situation. Now I read well, and this is actually you have please.
My name is Andrei. I just came today morning, so I would just here take a few words on behalf of International Nordic Walking Association, where I come from. It's the Sauva Kaveri Association for Finnish people, global organization which is a happy partner of Tafisa, and here there is also possible partners and question marks, so I would just like to express that INVA will be happy to be active partner in this, in developing active cities concept. That's one thing, and there are reasons for that, of course, and one of the very important reasons is that Nordic walking, Sauva Kaveri, is outdoor activity, and this is also maybe one of important points for Tafisa to, in criteria or in approach to decide about what to develop more, outdoor or indoor activities for active cities. Indoor activities demand big high investments into indoor facilities, indoor gyms, infrastructure and so on, while outdoor activity is of course cheaper in many ways. And on the other side, if we talk about outdoor activities, then we come to the question of environmental issues. So maybe Tafisa's message for active city would be even stronger if we talk about outdoor activities because of pollution, big pollution in big cities, So maybe this could be gathered not only sport and medicine, but also environmental society, so that the message of the need for more clean air, at least, could be implemented into this Tafisa concept of active city. Maybe the message would get stronger.
Green
and Nordic walking as an outside activity, which is very, very extremely cheap. So it could be one nice, if I don't say important, part of this active city. So I believe that, like Ilka said, that most probably we have to have a wider view now also from other groups.
Very good. Okay, but now I think that now we are going to take a break.